Pleasure to be here. All right, so that's going. All right, so what I'm going to be talking about is mood and coping in Parkinson's disease. Um, we are going to spend a little bit of time talking about just generally non-motor symptoms in Parkinson's disease. And we're going to focus then on depression and anxiety. I'm going to spend a lot of time there. We'll touch on treatment and coping. I had given a prior presentation that really focused on coping that some of you may have seen. So we're going to see, we're going to go at a leisurely pace. We'll take time for questions and we'll see how far we get. As I go, if people have questions they want to type into the chat, sometimes I can just work those questions into what we're already talking about. And so feel free to type them in the chat box. If I can get to them as we go, we will. Otherwise, we'll pause at different points to answer questions as they come up. So, when people think about Parkinson's disease, often people think of it as a motor disorder, right, or a movement disorder. We think of the cardinal signs, as being very physical in nature, right? Tremor, slow movement, stiffness, loss of balance, and that's absolutely true. But that's in some ways kind of the tip of the iceberg, right? It's kind of what you might see. It's what might get a little bit more attention, but there is a lot more that's very common in Parkinson's that is, not always as obvious or not always as talked about. And so, there's been increasing recognition that yes, Parkinson's disease is a movement disorder, but it can also be understood as kind of a neuropsychiatric disorder, right? There's lots of other things that are very common in Parkinson's, and depression, anxiety are the ones we're going to talk about, but also apathy, psychosis, impulse control, problems with sleep, cognitive concerns. And those are just the ones in that umbrella, right? There's many other non-motor symptoms that you're likely familiar with, right? Like whether it be changes in smell or, constipation. There's lots of kind of non-motor symptoms. We're going to focus on these neuropsychiatric symptoms, especially depression and anxiety. But I wanted to just kind of put that list up there to really, just emphasize the point that there's much more to Parkinson's than, tremor, stiffness, gait freezing. And so we're not going to spend a lot of time, but just to talk about the why of that, right? Going back to the brain before we kind of talk a little bit more about what it looks like, is, the motor symptoms. They come from this loss of dopamine producing neurons, right? In a particular part of the brain. You may also have heard of Lewy bodies, which is this, this happens in a certain part of the brain. And if it happens in the motor systems, that's where we see, tremor, slowing, and other motor symptoms. But this can also happen in other parts of the brain. And, it can happen in parts of the brain that might influence sleep, right? That might influence mood, that might influence smell. And so, this can also help us understand why two people with Parkinson's, they're both diagnosed with Parkinson's and their symptoms can look so very different. That this we can understand as part of what contributes to such symptom differences. There's also, we know that dopamine, right? There's a loss of this dopamine producing neuron, and dopamine is something that is involved in regulating mood and motivation. So it would make sense that we would see some changes in mood for some people, right? This is not something that affects everyone, but it is something that affects many people. And so, depression and anxiety are some of the more common neuropsychiatric symptoms. So it's why I wanted to focus on them. We could do kind of a talk on every single one on that list that I listed. But starting with depression. First, what do we mean when we say depression? Sadness, right, or crying, difficulty feeling enjoyment or pleasure, And those are ones that may be a little bit more obvious. But when people use the term depression, they don't mean just being sad, for a day or two, or just not enjoying something in the moment when something's going on. It's a lot more than that, and it's when multiple things they happen all at once and they stick around for a few weeks at a time. So it can also be appetite changes, sleep problems, fatigue, feeling guilty or worthless, having trouble concentrating, being really slowed down or being very agitated, having thoughts about self-harm or ending your life. Um, and when we call it depression, these are things that more than one is happening, and they're sticking around for a few weeks, and they're causing you distress, right? So it's more than just, obviously after diagnosis with a chronic illness or after a difficult week, lots of people feel sad. And this is a little bit more than that, where it's become more of a problem and it's really sticking around. I wanted to say a quick note on apathy, which is something that also occurs in Parkinson's and can be a little bit hard to distinguish. But apathy is really when there's this lack of motivation or difficulty getting started, not kind of caring as much about different activities. On the surface, it can sometimes look like depression. And what differentiates those is often just the person's experience, right? Where someone is not maybe motivated or kind of getting up and doing things, but they may not be feeling worthless, feeling sad. So it can, look similar, where someone may be staying home more or not as engaged. And that's why it's important to dig a little deeper onto the, why might that person be, struggling to do things that they may have once done. So how common is depression in Parkinson's disease? Major depression, and this kind of means that, when we look through all of those kind of symptoms list where there's a lot of those and they're really causing trouble, they're kind of, fully there and causing a lot of distress. Obviously, it's hard to get precise numbers. Anywhere from 5 to 20% of people with Parkinson's will kind of have what we could consider kind of more severe clinical depression, where they're meeting all of those boxes and maybe struggling a little bit more. A lot more people, anywhere from 10 to 30% more than that, so we're looking at, up to half of people with Parkinson's might deal with what we could call subsyndromal, or, not quite checking all of those boxes, but still dealing, maybe with a bit of, sadness, change in appetite. So, certainly a lot of people deal with depression. If we change the question to, how many people with Parkinson's have dealt with any kind of emotional concern, whether it be depression, anxiety, impulse control, then that number goes way up, because a lot of people have dealt with something in that realm. Risk factors, we can kind of, think about what makes this more or less likely. And we know from research that women are at a higher risk of depression. People who have had depression before can be at a higher risk of, becoming depressed later on. People with a family history, right? So other people in the family that have dealt with depression, individuals who have early onset Parkinson's, individuals with atypical Parkinsonism. Those are some of those conditions that can at different points be confused with Parkinson's, like progressive supranuclear palsy, also have particularly high rates of depression. And then, people who are also dealing with other psychiatric concerns, like, thinking difficulties, psychosis, anxiety, apathy, fatigue, insomnia, can also be at higher risk. And so when we think about depression specifically in Parkinson's, there's higher rates of depression in chronic illness in general, right? So people dealing with chronic illness have higher rates of depression. It's a lot to deal with, right? There's some research to suggest that depression can be a little bit more common in Parkinson's, and in part, people have noticed that depression sometimes precedes motor symptoms. So this is, definitely not everyone, but some people, one of the first symptoms they might notice is depression, even before they're noticing motor symptoms. The severity of depression sometimes is related to Parkinson's disease severity. And you'll see I started abbreviating here where I put PD. I'm referring to Parkinson's disease, where, some people who are, have, as their Parkinson's symptoms progress, they might notice their depression is more severe. Um, and as we mentioned, that there are, some changes in brain systems that regulate mood. So we could kind of understand how that could happen. Importantly, and this is always true, that depression is really complicated. It's not always, so clear. And so for some people, it could be, depression could really be linked into, brain-based changes that we see in Parkinson's. For others, it might be more of a reaction to what they're dealing with, in terms of, how Parkinson's has affected their life. For other people, it can be very much a separate phenomenon, right? Someone who may have developed depression, whether or not they were diagnosed with Parkinson's. For others, it might be a combination of all three, right? So there's never kind of one clear answer, but we do know that all of these things can contribute to just raising the risk a bit, for depression and Parkinson's. And so I wanted to just pull back a little bit as we're talking about this. This, I think, is a good example of what we might call the biopsychosocial model of health. So you kind of see health there in the middle. That red circle, when we think about biomedical factors, this is often, sometimes this can be exclusively what's seen, right? Or you kind of go to the doctor, there's a medical problem, there's a medication, and that's kind of what's addressed. But we know that health and general well-being is a lot more, right, than just a particular diagnosis or a particular, medical problem. Our social well-being, right? How connected we are, how we feel about our relationships, what we're doing on a day-to-day basis. That affects how we feel, right? Which in turn affects our health. Psychologically, how we're thinking about things, how we're feeling, that also affects health, right? And I think there's very common examples where, a lot of people will say, when I'm feeling really anxious, my tremor gets much worse, right? Or I have, I have a fight with my, spouse and I don't sleep very well, right? Where we kind of know, or, I have a hard time taking my medication regularly when I'm stressed. There's all of this kind of interaction. That kind of lets us think, kind of zoom out a little bit and appreciate that, oh yeah, it's not just, it's not just finding the right medication for my tremor that's going to contribute to health. That's extremely important. But there's, a lot that can affect health in lots of other ways. And I see there's a question about apathy and kind of being lethargic. The term kind of lethargy, I tend to think of it, I hear it a little bit less clinically. I tend to think of energy levels, right? Of just being kind of physically fatigued. Whereas apathy tends to refer a little bit more to more of a mental component, of being, having that hard time getting that motivation, right? So not necessarily because you're tired, just because, really, really can't get motivated to do that right now. That's how I would understand the difference there. They're certainly similar, right? So if you're feeling lethargic, you may also kind of have a hard time. They're certainly similar, I think, but slightly different. So this is kind of just a little bit of a segue also, just as we're thinking about these kind of three pieces, right, of what contributes to health. I've been focusing a lot about just Parkinson's disease, but just diagnosis with a chronic illness in general creates, a lot of stress, right? And a lot of other issues that can contribute to changes in mood, right? There can be, feelings of loss and grief, changes in, body image and self-concept. You might encounter discrimination, right? Or instances of stigma. There could be more uncertainty, more unpredictability. Your quality of life may be a bit different. All of these things are also going to play a role in how you're feeling and how you're coping day to day. All right, so I want to switch to talking about anxiety. We can save questions for the end, or if anyone has a question about kind of depression or what we've talked about up till now, if you wanted to kind of put it in the chat box or unmute yourself quickly, feel free to do so. We'll also kind of talk about depression and questions at the end if nothing pressing is coming up. Going once. All right, let's talk about anxiety, and then we'll leave some time at the end if questions do pop up. All right, so when we talk about anxiety, we're talking about, worry, nervousness, tension, fear, panic, irritability, somatic symptoms, right? Sometimes people have tension headaches, they can get nausea, breathing quickly, all of those things. We often also see avoidance, which can be a little bit of a kind of a flag that anxiety might be present, of starting to, maybe I don't really know if I want to see people today, right? Might anxiety play a role in that? Or, I don't really want to do something. Might anxiety play a role in that? So that can sometimes be a flag that anxiety may be present. And as we talked about before, right, anxiety is something that everyone experiences. Anxiety is, it's actually very healthy, right? We all need a dose of anxiety to kind of stay alert and get done what we need to get done. And it's not until it becomes kind of a little bit out of control, or popping up in lots of situations, that it becomes a problem. And similar with depression and sadness, we get more concerned when it's something that is coming up frequently. It's really causing issues, it's feeling kind of unmanageable, out of control, and it's affecting your day-to-day life. That's when we might kind of say, oh, this is kind of anxiety that rises to the level of a clinical issue, something you'd want to talk with your doctors about. How frequently does this occur? Again, it's hard to estimate. I found estimates of about 40% are reporting kind of clinical levels of anxiety. One thing that is unique to Parkinson's is sometimes people will describe when they have off periods, that they may experience anxiety then, that they may kind of really notice a fluctuation in their anxiety that's that tracks with their medications, with their Parkinson's medication. So that can be really helpful to note, because that could kind of lead to a treatment that might be a bit different than someone who notices that their anxiety is more linked to when they see other people, that it's more socially based, or has more to do with being worried about falling, different things, right? But it's important to kind of take note of that. And someone had asked, what are somatic symptoms that I listed on that anxiety slide? Somatic symptoms are some of the symptoms of anxiety that you can feel in your body, right? So that these symptoms are really wide ranging, right? Some people might say, I feel flushed when I feel anxious. I feel a little bit trembly. I feel nauseous. I feel tense. I get a headache. Any kind of symptom that's kind of in your body. Obviously, with Parkinson's and a lot of chronic illnesses, it can get a little bit confusing, right? Because you can feel, muscle tension for many reasons, right? Or you could have kind of nausea or GI issues related to Parkinson's or related to anxiety. So obviously it gets, it can get a little bit messy, but we do know that there's often this synergistic effect, right? Where anxiety can often just kind of up the level of difficulty with some of the issues that you're already experiencing. All right, so we talked about that. What are risk factors for anxiety? Again, anxiety is seen, or at least reported, more commonly in women, with individuals who are diagnosed with Parkinson's at a younger age, and individuals who whose Parkinson's is more advanced. And why is this important? I don't think I kind of need to explain why this is important, but it's very important. And I think one of the reasons I like to kind of emphasize this is, sometimes I think people can treat it a little bit more as an afterthought, right? There can be so much focus on getting motor symptoms under control, which obviously is very important, but that sometimes these can fall a little bit on the back burner. But depression and anxiety can affect a lot of things. They affect our thinking skills, right? Depression can sometimes look like dementia when it's severe. They can affect just severity of physical symptoms, right? As I mentioned, some people, when they're dealing with stress or anxiety, their physical symptoms are a lot worse. It's harder to take good care of yourself when you're struggling with significant depression or anxiety, right? It can be hard to maybe take your medications, or get out and do things that would be good for your health. It can sometimes even be hard to connect with your doctor, other healthcare services when you're not feeling well. It can put a big strain on relationships. It can certainly affect your relationship with your care partner and your care partner's well-being. And so certainly, depression and anxiety, they can affect a lot of things. And in some research, mood and other non-motor symptoms are sometimes even a bigger determinant of quality of life than motor symptoms, right? So these are, they deserve attention, I think, because they can sometimes be pushed a little bit to the side, but they are important to think about, because they have a big impact on quality of life, and on just day-to-day activities, and on health, right? They kind of feed back into health as well, as we talked about. And so treatment, medication, so the different treatment options, right, kind of fall into the category of medication treatment, therapy, and then just general kind of lifestyle and well-being factors that affect general health as well. And so, for medications, you would speak with your doctor, sometimes your neurologist, sometimes a psychiatrist is kind of specially trained. But oftentimes, just in dealing with, Parkinson's, you may want to start with your neurologist. They may have thoughts. Antidepressants and SSRIs are often prescribed, both within Parkinson's and without. For some, and I mentioned that for some people, depression is an early symptom, a symptom that they experience maybe even before other motor symptoms. For those people, sometimes getting on, Parkinson's medications will help. That is not necessarily the case for someone who experiences, depression at different points. But for some, especially those who might experience it as an early symptom, they might notice a change in mood once they start Parkinson's medications. For anxiety, antidepressants are also often prescribed as a kind of a first line medication option. For those people who notice that their anxiety is really linked with off periods, that's something to bring up to your neurologist, because that there may be something around timing or things that you might be able to talk about with that. Benzodiazepines are something that are sometimes prescribed for anxiety. Short term, they can be very helpful. Long term, sometimes they can be helpful, but you want to be careful, because they can also contribute to feeling sedated, some thinking concerns. Sometimes it can affect walking and gait. So that is something that is often not a first line, and is often, if many other things have not worked. So just a kind of note on that. Therapy, especially cognitive behavioral therapy, that's a bit more focused on coping and a more active approach, is something that's also been shown to support people and to improve mood and anxiety, and limit how much those might be directly affecting quality of life, and kind of living in a way that is consistent with what you want to be doing and what you value. Other lifestyle factors, things that just affect health in general, also impact, mood one way or the other. So exercise and movement, right, can be very helpful. Sleep is important. Social connectedness, right, we know has a big impact on mood and health. So those are just some kind of more lifestyle factors that we want to be thinking about when we think about, how do we want to treat or manage some of those mood concerns. All right, so that wraps up kind of the first half, thinking about kind of depression and anxiety. If people want to take a moment and kind of turn their microphones off, if people have questions, I'm happy to answer them and spend a little bit of time on that before we move on to the second half. If we even want to move on to the second half, we can see kind of how, if there are a lot of questions. Let's see. COVID isolation. I'm very glad that someone brought that up. I would fully agree. So I'm looking in the chat and someone had said, I think that COVID isolation has exacerbated anxiety issues. I couldn't agree more. And I think it makes sense why, right? I think I think for everyone, it has exacerbated anxiety, right? There's a lot to worry about. And it's often on the forefront, right? Of kind of, and you're thinking about risk, right? What's my risk? So there's that just anxiety that, affects everyone equally. And then I think people that manage a chronic illness, are also, thinking about their, unique case and trying to figure out, well, what is my risk given, my unique situation. And then there's also the fact that it's altered so many support systems, right? So, and so many people's routines, right? Routines that were established, supports that were in place, places that you might have gone, or, people you might have gathered with, that was really disrupted. And, it's for some people, it may have normalized at different points, but for many people it has not. And people are more isolated. They may have less on the agenda. There's a lot more to think about in making plans. So I think that a lot of people are noticing, right, that people are dealing with more anxiety, more depression. We were kind of talking at the beginning of the call that even, cognitive concerns and thinking skills, right, that those things can worsen, right? When people are more isolated, they have less going on, they're less stimulated. So I think that COVID absolutely has affected mental health in all of these ways, right? Both directly, just worrying about COVID, and indirectly. And it's, when we think about, well, what do we do about that? People have had to get a lot more creative, right? Of, I can't just maybe walk down to, or, go someplace and go inside and get that social contact. And so, I've got to do, this Zoom thing, or I've got to, find other ways of kind of getting at it that take a lot more work and are, not always so easy. So yeah, thank you for bringing that up. I think that's a good point. Anyone else have a question or comment? Let's see. All right, let's see. So I'm going to read, going to kind of summarize this comment that in terms of, experiencing fatigue and rigidity, that they're kind of standing out as clearly having Parkinson's, can't kind of blend in, that this affects self-image, going to busier places, concerns about appearing drunk. Yeah, so this person is kind of describing, right, that they might be experiencing kind of more anxiety or concern as their symptoms become more obvious to others, right? And I think that's a good point in general, is that, across, that people's experiences are very individual, right? And so some people might deal with a lot of mood concerns maybe right after diagnosis. Other people may deal with, concerns at different points. So, this could be a real change where all of a sudden, whereas, it may have been a more private experience, now suddenly it's a more public experience. And how do you manage that, right? It can take a big adjustment to how you think about going certain places, how you think about, who you want to, talk about a diagnosis with, what kinds of information you want to share. And I think noticing those patterns, right, of where this anxiety is coming up, and thinking a little bit about the why, right? What are some of those thoughts? Is it concerns about what other people might think? Is it concerns about how you might appear? Is it concerns about what you might do in case of an emergency, right? What are the worries? What are the concerns? and, you know, oftentimes in any kind of a treatment, or just, you know, as you go through your own mind, thinking about, you know, what is in your control. If there are, you know, sometimes anxiety will flag something that needs taken care of, right? Where, you know, I find that, you know, I'm walking too far and not giving myself breaks, you know, okay, I can maybe control that a little bit. I can't control what other people think, you know, but I can control kind of what I'm telling myself, and, you know, kind of focusing a bit in on that. All right, so thank you for that comment or question. Anyone else have anything they wanted to, you know, either say out loud or type in the chat?
Caitlin, can I ask a
Yeah,
question?
yeah,
Can
please.
you just said something very interesting. I wondered if you could expand on it when you said that you can control what you tell yourself. You
Mhm.
can't control what other people say, but you can control what you say to yourself. Can you expand on that a little bit?
Yeah, definitely. And actually, Claire, that's a nice segue. I know I have a diagram in this next in this next
It's all planned. It was all
it's all planned. That was a good one. So yeah, so what often when we think about like an emotional response, we think about thoughts, we think about our body, and we think about behavior. And so what I had mentioned there and what Gloria had said is thoughts are something, right, that we can't control, but we can kind of look at and we can shift, right? And we can notice if there's a problem there. So when we think about an emotion like anxiety, for example, so I have this picture on the screen where we can think of this kind of little triangle, or in here it's a little funnel. This is kind of the cognitive behavioral model where you know, say you you know, so you're out in public and you find that you're staggering more when you're walking, right? And so, you know, in your body, if that's provoking kind of an anxiety response, you might notice, you know, maybe you're feeling a little nauseous, you're feeling a little flushed, you're feeling a little bit more trembly. So you would kind of check in with your body. You might check in with your thoughts, right? So some people might be have, you know, anxiety provoking thoughts like, you know, what if I fall, right? What would I do? Other people's worries might be more in line of like, that person is looking at me, they're thinking that I can't handle myself, right? Or they're thinking something negative about me, right? Whereas someone else's anxieties might be, you know, more related to a different concern, like falling, or really anything. And then there's the behavior, right? What do you do? Sometimes when anxiety can become a problem, that behavior might look like, you know, going as fast as you can back to your car and not going back to that place because you worry that person might see you again and have that thought, right? Or it could look like, you know, continuing on, or maybe taking a little break until you're feeling, you know, ready to keep walking. The behavior could also look like a more active skill, like, you know, examining some of those thoughts and thinking, you know, well, I don't really know what that person is thinking, right? They may be thinking that, they may not. They may not have really noticed it as much as I think, right? So examining those thoughts, and that's when we think about this is, you know, cognitive behavioral therapy. This is often what that would help somebody do, is kind of notice those patterns, break that down a bit, and you know, you really can't know it if anyone's ever told you, well, don't be so anxious, right? That's that's not so helpful. That doesn't work, because it's this kind of big idea, right? And so you can't necessarily snap your fingers and be less anxious, right? You can't kind of snap your fingers and be less sad. But when you start thinking about, you know, what are some of the things I might tell myself that make me feel sad? Or what are some of the things that I tell myself that make me really worried? Sometimes we can shift things there, right? Also, sometimes, you know, we can say, well, how does your body feel? Because sometimes you can shift things there, right? By breathing a little bit differently, or doing some relaxation, or getting some exercise. Maybe you can shift things there. Same thing with your actions, right? Maybe you're kind of noticing that you're spending a lot of time at home, right, or alone, and that's affecting your mood. Maybe you can shift things there a little bit. So sometimes when you break it down, it can feel a little bit more manageable. So that's one way that we can think about breaking things down. Another way, just kind of when we think about coping skills in general, what we want to try to encourage are what we might call like adaptive coping skills or more engaged coping skills, where you're kind of noticing an issue and kind of, thinking about it a little bit in a way where, is this something I can solve? Am I taking, care of myself in a way that might help this? Can I, talk to someone or get support? And that's kind of what we want to support and encourage. Other coping skills that tend to, not ultimately help mood are things like, well, if I just never think about it, maybe it will kind of go away. And oftentimes that doesn't work so well, right? Or, maybe I'll just, have an extra drink. And that'll help me forget a little bit. And if that becomes really habitual, that can be a problem. Or, blaming. These are things that kind of disengage a little bit. That can be a little bit less helpful. And so, any questions about that kind of cognitive behavioral model before I go through and do kind of a speed review about what I mean by that? All right. Before I'll go through kind of that kind of CBT model quickly. Before I do that, I think this can sometimes get lost, right? When we talk about anxiety and depression, is one thing I always want to emphasize is that emotions do serve a purpose, right? So we don't want to disregard the fact that emotions are important, right? And oftentimes things are sad and they are anxiety provoking. And so feeling those feelings is not bad. It makes sense, right? Our emotions they're kind of like messengers, right? They help guide our decisions, right? They help us take action. They tell us who we are, what we like, what we dislike, what's important to us, what we value. They help us communicate with other people. So, certainly when we think about coping, what we're not saying is you shouldn't feel sad, right? Or you shouldn't feel worried, because oftentimes life is sad, right? And circumstances can rightfully, create anxiety. But it is saying to kind of look at some of those things and think about how we cope with them, right? And so anxiety can be really helpful, right? Oftentimes anxiety is what gets us to make that doctor's appointment that we really should make, right? Or gets us to pay a little bit more attention to make sure we're, taking our medication, or, getting things done that we need to get done. So often we need some of those feelings to do what we need to do. What we want is to help them kind of stay in, to kind of be related to what's going on around us, and to kind of fit the situation, so that we're feeling sad when we're going through a really sad thing, and then maybe we're able to enjoy something when that's less present. So we've got about I'm going to do a little speed round here, where we're going to think about this model, and the last kind of 5 or 10 minutes, I'll do a little speed round of what might that look like to target each of these factors of an emotional experience. And I'll go through it pretty quickly because we don't have all that much time left, but it'll be a little bit of a kind of a brief review. So we had just mentioned thoughts, right? So this is one thing that we're going to think about what we tell ourselves, and we're going to especially see if we can find any thinking errors or kind of distorted thinking, things that can be particularly, black and white. Because I can't do what I used to do, I'm useless, right? Well, those are really far away categories, right? What's in that kind of middle ground, right? Any thoughts that are unhelpful, right? Really noticing, because sometimes, the things that we say out loud to other people, we hear. Oftentimes the things we say to ourselves, we don't hear. And sometimes if we did hear it, we'd say, wow, I would never speak to someone I cared about, right? In that I would never tell someone the things that I think in my own head and tell myself. And so, here's an example of a situation, right? I'm at home on the couch, I'm feeling kind of depressed. The thought is I can no longer run marathons. Why exercise at all? right? That's an example of kind of an extreme thought. Um, Another situation of thinking about going to a party, feeling anxious or scared, noticing the thought that it would be horrible if people saw me shake. So this is kind of a situation. Noticing that is always the first step. So just kind of noticing what's going on. Um, Often, a thought, a question that I might, work with clients um, to think is, are your thoughts balanced, right? If you kind of put it out there to a jury of your peers, right? What's the evidence for that? What's the evidence against that? Um, and so for this first one, right, I can't run marathons, why exercise at all? Well, you might not be able to, but there may be other ways that you could challenge yourself physically, right? Um, and exercise can really improve Parkinson's symptoms, right? So you may not exercise in the same way, but there may also be this benefit you could focus on. Um, for this other scenario, right? It would be horrible if people see me shake. What's the worst case scenario, right? Might they stare? Could you still have fun, even if you're sometimes feeling self-conscious, right? So just shifting a little bit of what you're telling yourself, because if it's going to be horrible, then you're not going to go, right? If you can shift a little bit of, there might be things that are uncomfortable about it, but might there be other things that are kind of worthwhile. And I'm going to skip that. And there's a question about how can we help our partners to not let anxiety or depression control their world. Um, it's it's kind of a big question, right? I think there's only so much that, as other people we can do besides kind of giving support, maybe encouragement, for other resources, right? So learning more about it, maybe raising it at a doctor's appointment, maybe encouraging, you know, d- investigating other supports like, therapists that could also be helpful. And outside of, just getting that additional help and support, sometimes, just as we're talking about thoughts, just being as specific um, as as possible, right? Of like, what is the worry? So there's anxiety coming up. What's the worry? What's the worst case scenario, right? What is the concern? Because sometimes there can be some problem solving, because anxiety and depression can be very isolating. And so sometimes, right, if there's, you know, certain concerns, if we can get really specific about them, talk about them a little bit more, and maybe there could be some problem solving, and if not problem solving, maybe there could be some support to kind of help a little bit. um, and someone else had said, when people notice my tremors, I use it as a teaching moment and open a conversation with them. This is a great way of kind of reframing something as, that might have been perceived as, kind of a negative interaction, that it could actually be a positive interaction of getting the chance to, educate somebody, or to help someone learn something that they might not know, and have that information for next time. Thank you. Okay, in our speed round here at the end, what about behavior? So this is like actions. What are you doing? And so again, it always initially comes down to just noticing it, right? Because sometimes we just act driven by emotions, right? So when you're feeling a lot of anxiety or sadness, right? How do you act? Do you withdraw? Do you avoid things? Do you yell? Do you get angry? Noticing that, kind of understanding that, and working to kind of switch those behaviors that don't work well for you, right? So do you, yell at friends, and, actually you'd rather kind of spend more time? Do you avoid things that when you do it, you notice that it boosts your mood a little bit? Seeking out social support, improving communication, and I'm going to skim over this a little bit because that's a topic in itself. But focusing on what you can do, even if it means making adjustments, right? Pacing. So, maybe you can't travel in the way that you might have, but is there, something you can do with some adaptations, or something closer to home that would still, be interesting or new? Identifying barriers and problem solving. Right, we can get kind of stuck in the way that we've always done things, and zooming out a little bit and thinking, are there other ways that I could kind of meet this need in a different way. Um, and finding some way to just get some pleasurable activities. I think, during COVID, a lot of people lost this, and it can feel, especially when there's so much going on in the world, it can feel hard to say, well, I should make time to, knit, right? It can feel like a small thing. But small things often build up, right? And if you don't have anything going that you enjoy, that can really impact mood. So, even if it doesn't always feel important, thinking about what are the things that you enjoy, and making sure that you make time for them. Um, and then the last part of this, or like the body response, um, these are things that we can target. Again, we can't affect this change in this big emotional experience, but we can affect, we can control our breathing, right? So when you're feeling really physically tense, right, can you take a minute and practice, the skills that might help you to calm down physically, whether it's deep breathing, paying attention to what's going on around you, and then just taking care of yourself as best you can, because often, I think most people know this, if you've had a really bad night of sleep, your patience, right, might be a bit lower. You might be, your mood may be worse. You may be more likely have a harder time coping with an anxiety provoking situation. So just taking anything that's good for your general health can also sometimes just increase your capacity for coping, right? So that's, exercise, healthy eating, sleep, all those things that you do for yourself anyway, also, absolutely affect your mood. All right, we're going to skim over that. We're not going to spend a lot of time on sleep. So that's kind of the speed round of the cognitive behavioral model, right? How you could focus some coping skills on your thoughts, coping skills on your kind of body, coping skills on your actions, that can, help you cope with difficult feelings, difficult situations. And then we had talked a little bit about treatment earlier, right? Everyone uses coping skills. We all need coping skills just to kind of get through the day. Whether you call them coping skills or not, we all have ways that we respond to feelings, right? And sometimes they're helpful, sometimes they're not. So we all do that, and we all experience emotions, anxiety, sadness, all of those things. When do you want to seek additional help? Is when, and I kind of touched on this earlier, is that, depression and anxiety can absolutely, they impact your quality of life. They have a real impact. And if you're noticing that your mood is just really low all the time, right? You're having thoughts about, self-harm, right? Or not wanting to be here. You're feeling guilty, worthless, or your anxiety is so much that you're avoiding things that you really want to be doing. Or, you're dealing with it with substance or with other things that are not helpful. Those are signs that you really want to bring it up with someone that you trust, with a doctor, with a friend, a family member, because there are treatments that could help, and that could make your coping with these things a little bit easier. And that is the end. All right. And all right, so I'm noticing the comments. Yep, so someone's mentioning kind of how they adapted to some of their hobbies. So taking photography in shorter periods of time, spending more time outdoors, and not expecting that they're going to do it exactly the same, but still working on doing it. Yeah, that's a great example of kind of coping, right? Or kind of adjusting to still be doing something you enjoy in a way that's, feasible. And then someone else said, talk about sleep. That's a topic. That's a topic all in its own. But I can talk a little bit about, does anyone else have a question about mood? Because if I get started, we only have about 4 minutes left, and that's a big topic.
Caitlin, you want to give us 4 minutes worth of sleep?
4 minutes worth of sleep. Here we go. All right. So sleep is a big topic. It's commonly disrupted in anytime there's a stressful life event. Certainly in Parkinson's. Sleep hygiene is something that you may have heard of, just like kind of habits that can prevent temporary sleep problems from getting really embedded, right? Because sometimes what will happen is, you go through a period of bad sleep, and these other habits can kind of take hold that make sleep harder and harder. And so some kind of rules of thumb is, some people find that if you don't need naps, kind of eliminating them. Some people find that naps are helpful, but you want to plan them for kind of before 3 o'clock. It depends a little bit when you go to sleep and your schedule, but keeping them in the middle of the day, limiting them to less than 30 minutes. And that includes folks who kind of close their eyes watching TV late at night. That can be very disruptive to falling asleep later. So I'm trying to plan your naps, and keep them in the middle of the day, time limited. Obviously, this kind of changes based on your own situation, but generally speaking, sticking to a bedtime routine, right? That includes sleep-friendly activities that help you relax. So that's not so much screens, and that's actually a different bullet point, right? Because we want to try to avoid light later in the evening, and kind of maximize it earlier in the day, right? We want to kind of get a lot of bright sunshine in the morning and afternoon, and then try to get less light as we get closer to bedtime to kind of help our brains a little bit, keep us on a rhythm. Another thing that helps us with that rhythm is maintaining a consistent bedtime and wake time. For people who struggle with sleep, even on the weekends, it can be tempting to say, well, I slept so badly, I'm going to get a few extra hours this morning. But if you're someone who struggles with sleep, really keeping that same wake time and trying to have that consistency can be helpful. Trying to get movement or exercise earlier in the day, drinking, as much, water and fluid as you can earlier in the day, and stopping, if you're able to early in the evening, trying to avoid caffeine. Alcohol also tends to make us a little sleepy initially, but disrupts sleep later on. So that's also not a great strategy. So there's the 4 minutes on some kind of strategies to do some best practices for sleep. And coming in right under the wire at 5:29.
That's amazing. That's amazing. I love that. I love that, Caitlin. That's great. But we're going to take that minute.
All right, let's use that a minute. I'll stop sharing my screen.
Stop the share. So I'm going to use Caitlin's every minute. Anybody have a thought, a question? You can yell it out. You can write it in the chat. Oh, was there something in the chat? Oh, nice presentation. Thank you. You got a lot of good thank yous. That's all wonderful. Any last thoughts or questions? Here's your chance. That was amazing. Lots and lots of good stuff there.
Well, thank you so much for having me.
Oh, it's our pleasure. And just so you're all aware, this is Mental Health Awareness Month, guys. And, it's a full month of lots of presentations and so on about mental health. So I thought it was really important to have a mental health conversation this month. And just for everyone to remember that, what I sometimes say, as in, we all say getting older is not for, not for sissies. Aging is not for sissies. And I think a chronic illness like PD is also not for sissies. And I think, really self-care and taking care of your mental health is what we have to do. Just the way you go to the doctor and you take care of all your physical stuff is what you need to do with all this other cognitive, social, psychological, and mental health stuff. So just be aware of that. And we will have this, hopefully we'll have this recording on our website. We'll let you know when it's there. So those of you that have friends and so on who are not able to be here, or you yourself want to review it, because there were so many tips that you may want to go over. I know I wrote a bunch of them down. I took a lot of notes myself. So thank you again, Caitlin, for that wonderful, wonderful presentation.
Thank you so much for having me. And I couldn't just putting a little bit of a spotlight on things that are not always brought up at doctor's appointments, just as kind of validating that these are really important concerns and things that are, worth talking about with, friends, family, doctors. They definitely matter.
Yeah, don't be shy about bringing them up if you're experiencing any of those symptoms. And, make sure somebody's paying attention and listening to you. Bring them up. Don't be ashamed or afraid or embarrassed to bring them up with a professional, with your doctor, with your neurologist, with a therapist, because they're very important to address and people should not have to suffer. There are ways to address them, so be aware of that. Okay, everybody, I'll get off my soapbox. Just glad to have you all here.
Thank you.
And we will have another session next month. We'll let you know. We'll send multiple emails out and let you know what we will be presenting next month for education and information. So take care, everybody, and
Right.
hopefully see you soon.
All right, thank you.
Bye. Take care.
Everyone.
Thank you.